Presiding Officer, the final mitigation measure I want to talk about today is the COVID certification scheme. It is the strong view of the Scottish Government that this, together with the other measures still in place, makes an important and proportionate contribution to stemming COVID transmission. The value of certification is also recognised in other countries, many of which require certification for access to a much wider range of services than is currently the case in Scotland. Wales, for example, expanded the scope of its own scheme yesterday. It now applies to theatres, cinemas and concert halls, in addition to the same range of venues as in Scotland. The Cabinet discussed possible changes to the current certification scheme at our meeting this morning. We intend to take a final decision next Tuesday in light of the most up-to-date data. So we will be assessing in the coming days whether, on the basis of current and projected vaccination uptake rates, we are now in a position to amend the scheme so that, in addition to showing evidence of vaccination to access a venue, there will also be the option of providing evidence of a recent negative test result. That is already a feature, of course, of many other countries' certification schemes. We are also considering whether an expansion of the scheme to cover more settings would be justified and prudent, given the current state of the pandemic. Again, let me stress that we have not at this stage taken a decision to extend the reach of the scheme. However, to allow us to engage openly with businesses in the coming days about the pros, cons and practicalities, I can confirm that the kinds of settings that might be in scope would be indoor cinemas, theatres and some other licensed and hospitality premises. We would, of course, retain exemptions for those under 18, for those who cannot be vaccinated or tested for medical reasons, for people on clinical trials and for those who work at events or in venues subject to the scheme. Exceptions would also be retained for worship, weddings, funerals and related gatherings. I will give a further update on this in next week's statement, and if we decide to propose any amendments to the regulations on certification, Parliament will have the opportunity to discuss and debate these amendments. While we can't yet draw final conclusions, I can confirm now that there is no sign so far of any significant spike in COVID cases associated with COP26. Rigorous measures were put in place to minimise the risks of transmission. For example, anyone entering the main summit site, the blue zone, had to provide evidence of a negative lateral flow test result. Information published earlier today by Public Health Scotland suggests that of the people officially affiliated with COP26, approximately 4 in every 1,000 tested positive for COVID through routine lateral flow testing. This contrasts with survey data for the Scottish population as a whole, which suggests that last week 12 people in every 1,000 had COVID. And in total, since the 15th of October, 291 people with COVID across Scotland reported attending a COP-related event. That includes satellite meetings and demonstrations, as well as the main summit itself. That represents less than half of 1% of all those who tested positive for COVID over the past month and reported through Test and Protect. All of this, at this stage, Presiding Officer, suggests that the mitigations that were put in place for COP were effective, and I want to put on record my thanks to delegates for their compliance and indeed to everyone who worked so hard in the run-up to and during COP26 to secure the safest possible environment.